make a video really about more information, important information about Klonopin. And I felt like in my first video I neglected to mention some major points about the major dangers, the most well-known dangers of benzodiazepine withdrawal. I guess maybe I thought, well, people already know it, but the fact that I got on the drug without knowing it means that people didn't and don't. So, aside from the protracted withdrawal syndrome, which is a real risk, and I was actually wrong. It's not 10%, it's even up to 10 to 15% of people tapering off benzodiazepines. But the most dangerous thing is that you just can't stop these drugs cold turkey. It's literally a risk to your life. And I didn't know this getting on the drug. If I had, there's no way possible that I would submit to taking this drug. Things that have been horrible for me the last 2.5 years. I know everyone says who likes pharmaceutical meds that, there's always side effects. Side effects are just part of taking meds. But, some side effects, of course, are intolerable, and that's why people get off. But if you can't get off safely from your medication, you're trapped. So if you have protracted withdrawal syndrome, and you stop taking your medication, and you experience vertigo, constant dizziness, constant forgetfulness, constant depersonalization, constant panic when you didn't even have these symptoms before. Like, it is prescribed for panic disorder, so maybe for some people it helps them stop panic, and it helps them, and then maybe through therapy they can learn how to manage panic symptoms upon discontinuation, given that they don't experience actual protracted withdrawal. But if you have an abnormal response to have, I can't see if I'm being seen. Okay, look like that one. But if you have protracted withdrawal, and if you have really severe protracted withdrawal symptoms, you're like in a catch-22, because you don't know how long these symptoms are going to last. Now, that means you're already in the rare camp, the 10 to 15% of people that experience this when most people don't. But if it's a couple weeks, okay. If it's a couple months, that sucks, especially if you have a job and you can't afford to have these like forgetfulness. You're gonna look stupid in front of your boss. How can you work? You could lose your job. Or if it's years, some people have years. I read a story about a girl who she tapered off too fast. She wasn't warned about the dangers of tapering off too fast. She developed protracted withdrawal. She lived for like a year, not knowing where she's going, walking around in a haze, totally lost her personality, lost her friends, lost her boyfriend, just like lost herself completely. And then upon uptaking the dose to what it was originally, the highest level of addiction, she regained all the features that she lost. Okay, so that means now, just because she tried a drug out, because she had she had some crisis in her life, an emotional crisis, she took it. Now she has to take it the rest of her life, just because if she gets off, she won't be the same person. I mean, in the people that it causes the problem, there's brain damage done. Whether it's temporary or not is not the point. It's brain damage. And some people can't afford to lose months or years for their life to return to normal. Some people simply can't afford that. So, aside from that, you can't stop these drugs cold turkey. You can die of status epilepticus. You can die of convulsions. You can develop epilepsy when you've never even had epilepsy. And then you really have to be on serious anti-seizure meds to control the epilepsy that was caused by medication. Look at this. This is crazy. The situation that psychiatrists put people in. Psychiatrists got problems. And you know, it is the medical field's fault, because when there's a problem or someone's having a family crisis, or you know, they're acting out in high school or whatever, they all kind of like pass the buck down the line. They say, send them to the shrinks. That's not my specialty. But then they complain when I had a doctor complain about me because I started developing all these symptoms of panic disorder upon trying to taper off the anti-panic drug, when I didn't have that panic disorder before. Because my body just panicked after being deprived of the drug, and I didn't have it before. Since being on, getting off, lowering the dose, I've gone to the ER probably 20 times, freaking out, thinking I had this or that. It caused a total hypochondriac, I don't know what the adjective pronunciation, hypochondriac reaction in me, and also just being freaked out. And then the GP at the same time is like, you know, Sarah, I think you have a panic disorder. I think you need to see a psychiatrist. And they're like annoyed with all the help I'm trying to receive, and they're like, you know, you're using up a lot of the system's resources because you want to check and see if you have diabetes and all these things. You want to make sure this and that. And it's like, you know, how dare you complain if you're handing out these drugs like candy, and people are developing all these, you know, additional problems and want to get treated for the problems you've caused them, and you're telling them they're using up the system, and you're complaining to them going to the ER when they're freaked out and they don't know what the hell to do in the middle of the night, when they're just freaking out like it's World War III. Like, how dare they? That's what they get. That's the karmic retribution they get for making people into addicts and making their lives unravel. I'm not talking about all the people given benzos, but the ones where this has happened, this is the consequence. It's a backlash. And they should look to themselves as the cause. I don't know if I'm over time. I've got to stop. That was good angst, and I don't want that to be lost, so...